Let's talk about the vaccine skeptic and promoter of conspiracy theories, RFK Jr., a little bit more now. As you know, he's the president-elect's picks to become Health and Human Services Secretary. And if it hasn't just rattled you, believe me, it's setting off anxieties across our medical community now. Joining me now, former acting director of the CDC, Dr. Richard Besser. Great to see you again, Richard. Just your reaction to the possibility of a Secretary Kennedy leading HHS.
You know, Kyra, I think it is absolutely chilling and could have a really profound negative impact on people's health in America. When you look at the Department of Health and Human Services, it touches on every single life in our country. You know, I focus in a big way on public health and the public health system, and have real concerns that we would have someone in that position who has been one of the leaders in creating mistrust in our vaccine system and in our public health system. You know, I practiced pediatrics for more than 30 years, and I can tell you there's nothing that I did for my patients that had more proven value for their health than making sure they were vaccinated fully and on time. And Mr. Kennedy has done more than just about anybody in shaking the confidence that parents have in the vaccines that are given to children. But that's just one small piece of what HHS is responsible for. When you think about what is important for people's lives and health, access to healthcare coverage. He hasn't talked about that, but there are 27 million people in America without health insurance. What would it mean to have a Mr. Kennedy in that role in terms of those issues? These are things that have to be addressed in a confirmation hearing so senators can make a choice as to whether this is the person they want in that role.
He's also pushed for stricter regulations on ingredients used in processed foods. He's actually garnered a lot of support on social media for that as well. Is there a little positive light here within within all the craziness?
Well, you know, one of the big challenges with individuals who spread misinformation is that mixed in with the misinformation are bits of truth and fact. And you see those bits and you hold on to them and you say, well, I guess everything that's being said is true. I think it would be terrific if the new administration decides to have a big initiative, a big focus on chronic diseases in children, and really looks to say, what are the big drivers behind this and what can we do about it? I think looking at our nutrition system is really important. What would it take for this administration to say, we are going to make the school lunch program the best school lunch ever possible? There's a lot that would have to go into that. Yes, you want to get processed food out of the school lunch, but one of the big reasons so many schools serve processed food is that we haven't invested in the school kitchens so that they can make real food, healthy food. If the next Secretary of Health decides to take that on, that's terrific. But mixed in with the issues that are being lifted up are a lot of solutions that are not based on science. They're based on falsehood, and that makes it very, very confusing for the individual to decide, well, what here is true and what is not.
All right, then let me follow up on that. He really hasn't said a lot. If you think of RFK Jr., the first thing people really go to are sort of the wild things that he has said. So we've talked about the misinformation, we've talked about the myths, but let's focus on the truth for a second. Have you heard anything come out of his mouth that you sat back and went, oh, that's true, that sounds good, all right, let's focus on that?
Yeah, when I hear him say, let's reduce the influence of private corporations in government health decisions, I think that's absolutely terrific. You know, the next time the school lunch program is up for reauthorization, let's make sure that big business doesn't have a role in terms of what foods are included there. That would be terrific. If you look at the menthol ban that the FDA, the Food and Drug Administration, has been trying to put forward around smoking for so many administrations, let's keep big business out of there and truly protect everyone in America from the harms of smoking. That would go a long way to reduce chronic disease, given the role that tobacco plays in heart disease and stroke and lung disease. Those things are really important, and I would love to see that go forward.
Dr. Richard Besser, always appreciate your time. Thank you so much.